of medicine that has had limited abilities or advancements within the past decade or two. And so in this finding, they found that existing therapies were found to benefit those with specific types of cervical cancer. So they looked at 500 women and followed them for 20 years, and they all had a form of locally advanced cervical cancer, which essentially means that it has grown beyond what would normally be surgically removed, but it has not yet extended to the rest of the body. They gave half of these women standard chemotherapy, and they gave the other half an additional form of chemotherapy called induction chemotherapy before the standard. And they found that the half that they gave that additional form of chemotherapy had a reduced risk of death and progression by up to 35%.
As with most cancers, early detection is so key. It's not a guarantee.
Not a guarantee.
But it's so key. And there's some preventable measures that can be taken?
There are. You know, the most important thing is to know that the average age of diagnosis of this cancer is from 34 to 44. That means that screening and prevention need to start earlier. Screening involves things like pap smears and HPV testing, which ideally start at the age of 21. And then the most important way to prevent this is via vaccination against the human papillomavirus, HPV, which theoretically most, if not all, are going to be exposed to. Getting vaccinated by this early and young is one of the key ways to prevent this cancer.
Any other headlines out of the conference?
Treatments for endometrial cancer as well as bladder cancer coming up soon in the pipeline.
You're the best. All right, we'll see you on GMA 3.
Thank you.